Hello, hello, hello. Greetings to you all. Permit me introduce this new program on your favorite TV, the ABC Amber TV. Health is wealth. Of course, we invest in so many other things and we forget about the most essential, and that is our health. This is our goal for 2022 for Ambazonia. We want to build a healthy and therefore a wealthy nation.
Tune into ABC Amber TV every Monday from 7 p.m. Amber time for this exclusive educational and awareness program, Health is Wealth with Dr. Yaya.
The piece of cloth made in Ambazonia, a land brimming with history, courage, and the indomitable spirit of its people, a profound reflection of Ambazonia's collective identity and our unyielding struggle for freedom.
A full representation of who we are, what we are, the history, story, and the struggle. It's a piece of cloth you should have in your closet. It is woven into a rich tapestry of cultural heritage, traditions, and long-standing desire for self-determination. Proudly adorned with unique patterns and symbolizes unity in the Ambazonian people.
The cloth's patterns and colors mirror the courage and hope that fueled their aspirations for a brighter future. Each thread represented a story of bravery, sacrifice, and the unwavering commitment to justice.
The piece of cloth made in Ambazonia became more than just a garment. It transformed into a symbol of a call for recognition, worn proudly by Ambazonians and their allies worldwide. It carried a message: we exist and we deserve to be heard. As long as the cloth adorns chests and shoulders, the spirit of Ambazonia lives on, and the hope for a free and united land remains alive.
Good evening, ladies and gentlemen, dear comrades and viewers of our program, Health is Wealth. You're welcome on today's program. And as you can tell on the flyer, the topic we're going to be addressing today is gout, and also other topics involving concerning our struggle. So we're going to start, first of all, with the preparations for October 1. Oh, sorry, let's put it this way. We're going to start with a huge congratulations to Manu for the very successful draft just witnessed on Saturday that just passed. And we want to thank and congratulate all Ambazonians who once again came out and expressed their sense of patriotism and told the world, by telling the world that, you know, this is an Ambazonian struggle. We have 13 counties, but we have one Ambazonia. So we saw a huge turnout and especially a very effective draft, whereby a total, as at the time of the closure of the official draft, we actually documented $21,000 cash. We're talking of cash paid. So that was a huge success, and a huge congratulations, of course, to Manu County, and especially to the driving team, and that is the Department of Finance and Resource Mobilization, led by the Secretary of State, Nijo, and the new Deputy Secretary, who happens to be a princess of Manu, Masira. So what a double whammy. So it's a huge gain for Manu, but again, a very, very huge success at a personal level for Masira and as a collective for Ambazonia. So our next county coming up, as we know, we have now started with the roster of county drafts, which is every week actually, till we get through the entire 13 counties. And our next stop is KMC. So KMC is the great city of the Twin Lakes. We know about the topography. It's very, very special locations. And that, again, is another opportunity for Ambazonians to come out and support our comrades from KMC. Now we know that KMC is the one, and I believe the only county which is led by a female. Of course, in Amazonia, we are going to promote gender equality. But at this time of the struggle, we know that we can only work with available hands. And so we are very grateful to have this powerful woman who doubles up. In fact, she triples in so many different areas serving this government. One as the Secretary of State for Education, and also as the chair lady for her county. And she also wears different hats. So to her, we really dove our hat for her dedication and her commitment to our struggle. So please, a shout out to all the women. We know, of course, we have our woman. We have to support as women, and empower each other. So that's a special call, first of all, to all women in our struggle. Let's come out and support Prof. Epote as she leads her county into another draft, which we believe is going to be successful, as we have had a series of them till now. So that's this Saturday, starting at 8 p.m. And we're appealing to everybody that we really want these drafts to be on time so that we can finish on time and have a good rest so that people can go to work feeling rested. And especially, we just have to be considerate, considerate of, sorry, permit me, of our resource mobilization team who are really sitting, who are on this seat every week, week after week, over 6 to 7 hours. It is not a small job. So congratulations to them. I think that's the much I can say about the draft. If anyone has a call, I was hoping to reach out to the leadership, but that idea just came to me last minute, just like this program actually. So we will be seeing the KMC team sometime during this week on one of the programs, or at least on Undaunted. So stay tuned. So now let's see how we're doing with time, because I've got only 30 minutes. Sorry, bear with me. I need my final. Right. This is an impromptu coming now to the topic of gout. It's an impromptu topic. I decided to actually do it after talking to one of our brothers, who is suffering from this condition. And it's a very common condition anyway. And it just dawned on me. I said, oh, okay, today I'm actually free during the day, during the afternoon. So, we could talk about it. Again, yeah, to do these things, you need a little bit of preparation. I'm sorry I didn't really do that. So I'll be doing some little references, but we'll just keep it very general and very simple. So when we say gout, what exactly? I'm sure a lot of you have heard of it, or we know people who have suffered from gout. It's quite a common condition. So in simple terms, it is an inflammation of the joint space due to the presence of some crystals. They're called uric acid crystals. So these are actually, or let's put it this way, you have in the human body, has a system of metabolism. It's difficult explaining this now in English. So anyway, there are different pathways that the body breaks down different substances for its use, and then it gets rid of what it doesn't need. So we have that system that the body kind of auto-regulates itself. So when you have the breakdown of certain substances called purine, which are elements of what do you say? Basic units of proteins. No, I'm getting it wrong. Anyway, you have a certain substance in the body that has to be broken down. The last product is called purines, and they have to be excreted. And the kidney is responsible for the majority of that excretion. of the uric acid. So when you have gout, actually, when you have excessive uric acid in the system, and there are different reasons why you can have excessive uric acid in the system. Like I mentioned, the body always has a way of getting rid of its excess and regulating itself. So in the kidneys, where majority of or the yeah so 90% or more of this uh, byproduct of protein breakdown is actually excreted in the tubes. They call it the tubules or tubules of the kidneys. That's where you have this uric acid being excreted. So when you have gout, it is either because this secretion of the uric acid is impaired. For some reason, your kidneys are not able to get rid of the excessive uric acid, or on the other hand, you can have what you call secondary gout, which is not because of the failure of these tubules to excrete uric acid, but because of excessive production of the uric acid, and that could be due to a series of conditions, whereby there's a high breakdown of cells, like in cases of tumors, those who have, or people who have tumors or cancer of any sort, and you treat the cancer, what you're actually doing is, you're also breaking down cells, and therefore there is a high byproduct of this uric acid that's excessive. And even in a normal or well functioning system, the kidneys are oversaturated. They are not able to get rid of this excessive accumulation of this product, and therefore it kind of settles or accumulates in the joints mainly, or other organs that could be affected. So leukemia and like I said, cancer treatment in itself, and also excessive alcoholism has been shown to be another precipitant of this condition, and extreme fasting. I guess extreme fasting, you kind of switch your metabolism from the normal metabolism that uses up maybe sugars to produce energy, and you start to break down proteins, and the end product ends up being this uric acid that then accumulates. So let's see. I think let me go by the questions. Oh yeah, my excuses. My host is not on today, so I'm trying to be host and conversing with myself, so it's a bit tricky. Yeah. So how does gout present itself? In other words, what are the symptoms of gout? Usually when people talk about gout, the most common occurrence of gout is that which affects the big toe. I say usually, but not always, not exclusively. So the big toe is, how do you know that it is gout? Of course, you don't make your own diagnosis, but we're just trying to raise the awareness so that if you have those symptoms, you know that you have to rush to the doctor. If you have an acute onset of pain in your big toe, and it's swollen, it's red, it's hot, those are like the cardinal symptoms that are almost diagnostic of gout. However, you can always have other things, other conditions that can mimic that same presentation. So, but for purposes of simplicity, that's the commonest presentation. In 50% of the cases, gout would affect the big toe, and it will be very painful. It will be hot. It will be swollen, and the pain, especially when you move it or touch it, and again, like I said, it's only to 50% of the cases. Sometimes it can affect other joints, like the ankle. It can affect the knee, or the hand, ankle, sorry, hand, ankle, hand joints, or the elbow. The the thing with gout, or that helps to differentiate it from other kinds of arthritis or inflammation of the joint, is that it usually affects one joint. It's uncommon to affect many joints at once, like you may have in rheumatoid arthritis, or simply degenerative arthritis. So we talk about what are the precipitating factors uh, of gout? Like we said, excessive eating, because if you eat very heavy, like you're eating lots of meat and all the stuff that are rich in purine, of course you're overloading your body first of all with those the breakdown products or the byproducts, uh, and that's a load on your system. That's number one. So alcohol, we said, is a real trigger, and also dehydration, not having enough fluids in your system. Of course, if you have crystals and then you're dry, they will easily crystallize, and form like and those crystals are the agents that induce the inflammation in the joint. Then also sometimes fasting, yeah, and also medications that can cause dehydration or lead to it, like laxatives. People will take excessive laxatives. Sometimes it could be for constipation, but if you lose a lot of fluids, you lose a lot of water through soft stools, diarrhea, then you get into a state of dehydration, and that may induce gout. So people who take water pills, I'm not saying that is wrong, but they might be at risk, especially if there's not the right balance, if they haven't found the right balance between taking out the water like it's needed, maybe in heart failure or in kidney failure, and also having the right amount of fluids that your system needs, because we need blood, we need volume. So, sorry, I need to read. How do we know? How do we know it's gout, that we are dealing with gout? Of course, that's not for you as the patient to necessarily diagnose, but your doctor. But sometimes, I mean, it's good to know about general signs and symptoms. So if you're going to your doctor, you already know that you can also ask the questions. Remember, the doctor doesn't know it all. You can hear me babble over some things because nowadays people deal with so many different things. It is good for you to also know, to have that general knowledge of what uh, the symptoms could be like, and then going to the doctor would make you more, would empower you actually, so you can ask the right questions. Again, usually it is an acute onset, meaning the pain is sudden. Like you wake up, yesterday you were fine, and today suddenly you are in severe pain. But you have to rule out other things that can also cause pain, like fractures. If something heavy fell on your toe, and you're transferring, and a huge box falls on your toe, and the next morning is swollen red and hot as expected, it's not necessarily gout. It is likely a fracture or some soft tissue um, disturbance due to the trauma caused. So there are other things that can mimic gout, but gout, like we said, the typical presentation is in the absence of those other mimics, things that can mimic it. You have that acute onset. It means we're talking about acute gout, by the way, because you have a chronic recurrent gout. It might also have not that very acute or very rapid onset. It might just be a slow, but steadily increasing pain. Let's see how we're doing with time. I think we have 20 more minutes. So acute onset of pain, redness, warmth, and swelling. After having ruled out other things that could possibly cause that, like trauma, like fractures, like other arthritis. There are other causes of arthritis we wouldn't go into for the sake of simplicity. We'll just group them all as arthritis, and there are different subtypes. Like I said, they can also cause that. Like you have the rheumatoid arthritis, and also just the arthritis as a result of aging, wear and tear, what we call degenerative arthritis. You can have a reactivation of that, and it can also be similar to gout. Um, so, what is the treatment for gout? Again, if we understand how the disease, um, the disease process, is an excessive buildup of uric acid in your system for whatever reason, whether it's because your kidneys cannot excrete enough of it, or whether it's because you have an enzyme defect that leads to that kind of obstructs one step of that cascade of processes, and therefore you have a back stagnation of the byproducts, or whether it is due to a kidney problem in itself, and therefore the kidney is not able to actually excrete to do the work that it's supposed to do, because for some reason it's already impaired, due to other reasons. You end up with excessive uric acid in your system. So the treatment one would expect would be one, to get rid of this uric acid, and there are different points of what do you call it, of addressing this. Let's say the first thing that brings the patient to the doctor is the pain, and that pain, the redness, heat, the warmth, the swelling, those are signs of inflammation. So there's active inflammation in the joint, and so you need to address that as the first thing, because you want to take away the patient's symptoms before addressing the underlying cause. So the first approach is actually dealing with inflammation, and the medications that are commonly used are colchicine, or a group that is called non-steroidal anti-inflammatory drugs. As the word says, anti-inflammatory. In fact, that is actually the commonest one that is used, because it is quite common, with a relatively, you could say, less side effects, relatively, I say. So your doctor would know what to do, would give you any of these anti-steroidals like ibuprofen, indomethacin, diclofenac, piroxicam, those kind of names. You don't need to note them, but that's the family. Or the colchicine. But certain considerations need to be done. In people already with kidney impairment, it is a bit tricky, because all these medications can in turn worsen their kidney function. So, as a third line, in such a case where you're limited in what you can use, corticosteroids or steroids are the next step. You know, Again, like we said, every medication has a side effect. So we're not encouraging anyone to go buy medications or self-medicate in case you're of the medical field. It's always good to see your doctor and make sure he takes a proper history, does the right test that support the diagnosis, and also exclude other possible differential diagnosis, meaning other similar conditions, and then initiate the treatment, because there needs to be a follow-up. Okay. So how can you prevent gout? So now that we talk about foods that okay, let me keep it general. How can you prevent gout? If we look at those different precipitants, like dehydration, excessive alcohol, overeating, the things that you can reverse. Of course, for someone who is sick, somebody who has cancer and is undergoing treatment, chemotherapy, where the tumor cells are being bombarded and broken down at a very rapid rate, it leads to an excessive accumulation of these byproducts, uric acid accumulation. And they call that tumor lysis syndrome, which is actually an oncologic emergency. So in such cases, or people with leukemia or anemia, there's a certain type of anemia where the red cells are being destroyed. They are being broken down. So you also have an excessive release of these byproducts. So in that case, it's not about a diet. It's about an underlying condition that predisposes them to that. For those who are naturally born with an enzyme defect, you know, that they cannot, they don't have, or there's a defect in the enzyme that actually process one of these steps. You know, the diet may help in reducing, first of all, the load that you put to your system. Because think of it, if let's say you have different levels of the breakdown of this product, and at this level you have a genetic defect that you can't bypass. It will make sense to avoid overloading your system, first of all, with foodstuffs that would end up leading to a high residual uric acid level in your system. Of course, we have to live, we need these nutrients, but a dietitian is better placed to actually advise you on what is healthy, what you can avoid, and still not end up with some serious deficiencies. Because there's a tendency that, I know nowadays everything is fast. Even when patients see doctors, there's not enough time for doctors to actually explain to them, what they need to do, and you just make a statement like avoid this, and you have different types of patients: those who just take things lightly, and those who take it to the letter, and they will avoid it to a point where it becomes detrimental. So it's always important for the patient to also ask questions. A common one is you see a patient who comes in with dehydration and the blood pressure is right down because he barely drinks, and then when you ask the patient, he tells you, "Oh, but the doctor told me because of my heart or because of my kidneys, I shouldn't drink too much." Okay, that is correct, because you're trying to offload the heart that's already weak. It cannot pump. Its pump function is weak, so you're trying to what do you call it, lessen, to relieve the heart of that stress. But that is not to say that the patient should not drink water at all. So, but many a times, medical professionals, we fail to really explain the need for the balance. Yes, we don't want too much, but on the other hand, we also need the volume to be able to generate the blood pressure, the volume to supply blood to all the tissues that to maintain a normal functioning. So, what I'm trying to say here is what we know, of course, back home, especially, I mean, in the layman's term, we know that gout is Namoni man is sick, in the sense that we men who used to eat a lot of soya and meat and stuff like that, and they drink a lot of wine or beer, or and that was seen as a sign of affluence, maybe at the time or still now. Those were the people who had gout a lot. And why did we? So that confirms that theory that excessive eating, especially eating of red meat, which is very high in purines, uh, and alcohol being a precipitant because it precipitates dehydration, and all those are the common things that we can alter. So we can change our diet, and to to reduce the risk of having gout. And that's not to say it will never come, but you're definitely reducing the risk factors. So it's important that, though we have that general knowledge, avoid red meat, avoid alcohol, which are things we don't really need, because red meat particularly, is known to be a pro-inflammatory, and of course has a high protein content. Some people might say, "Oh, then what happens? I need proteins." But guess what? There are other sources of healthy proteins that are not pro-inflammatory. You have healthy proteins even in just grains like beans, lentils, lots of other things that may not necessarily be very high in purines. Uh, I would suggest if anyone has gout, yes, those major things you should avoid, like red meat. There's other clean, well, what do I mean by clean meat? Still healthier meat that is not so bad as red meat, like chicken or turkey, and do so without the skin if possible. And we should all also explore plant-based protein. There are lots of foods that we eat that are rich in proteins, but we just don't know. Just Google them. But above all, it's good, especially for those of us who are out here. We have the access to healthcare. See a dietitian, and they will tell you for sure what is good, and they are up to date with the latest. You know, and so that you don't end up in, as much as you're avoiding something, you don't end up in a deficiency that will cause another problem. So what are the side effects of treatment? Again, which is why I say I discourage, or we discourage, these programs are just meant to raise awareness about possible things, well, about the different common issues that we may find. It is not to replace your doctor. Please always see your doctor, because um, hearing something and actually seeing it, feeling it, and well, we cannot replace doctors. That's just the main thing. So when we follow these programs, it is to encourage us to actually be alert, and when we get the signs, to see a doctor quicker. Yeah, every medication has side effects, just like even food that we need for our bodies. Too much food has a side effect. It makes you put on weight, and weight comes with its own string of side effects that we know. At some point, your body, your joints start to find it difficult to carry that weight, and it starts to wear your joints out. We may not notice this when maybe we are youngish, but the older we get, then we discover that that skeleton is really struggling to put up with that weight. So anyway, all those medications have their potential side effects, and therefore you shouldn't self-medicate. See your doctor. He would know the right doses to give you based on your personal history. There's no such thing as my neighbor or my husband, my wife took this, and therefore I should just snatch his pill. Because there were certain considerations made before that dose or that medication was given to your wife, or your husband or child or whoever. Um, Common side effects, they all affect the kidneys. The colchicine can cause really bad diarrhea. Um, on the other hand, the anti-inflammatories in people with gastritis or ulcers actually can cause can worsen the gastritis. But usually these treatments are short term. They are not expected in an acute setup to be longer than a week. I think 5 days depends on the response actually. So just beware that every medication has a side effect. Um, so yeah, we talked about dietary. What dietary changes should one consider? Like we said, particularly red meat, alcohol, cut down completely, and then see your dietitian. Looking at the time, uh, to guide you on this and make sure that you are not being deficient on anything. So we're open to questions. Sorry, it's not so interesting talking and asking the same, asking yourself the same questions, but that's what it is. I just decided we'll never really be so ready. Oh my God, it's so hot. Sorry. We'll never really be so ready, so we better make do of what we can. And I was quite inspired just talking to a comrade yesterday. I thought, oh, we better discuss it halfway. I'm sure maybe next time I'll be more prepared and I can take questions. Um, yes, so if not, we have 5 more minutes. Director Paddy, I think I've gone through my scheme. You may want to talk about October 1. October 1. You can see my background here. It's our amber wrapper. So this Amber Wrapper is actually a project of ABC. Sorry, I'm being distracted here. I need my fan. Yeah, the ABC project to raise funds to be able to sustain itself. As we know, we have a full functioning TV. Although it's a revolutionary TV, it is still a running television, and we have people who work for us 24/7. We need to sustain this. We watch other corporations, and we want to take ABC to that level, and we can tell that ABC has made a a remarkable spring, the past year and a half. So please, if you want to encourage ABC, uh, just chip in, making your order, putting your order, and we have those payment links. I don't know if Director Paddy has them. Director Paddy, can you show us the payment links? Hello, Director Paddy. He might is a man of many multiple tasks. Anyway, so these things they float all around. So if you need a wrapper, just contact anyone in ABC, Ma Emma, Director Paddy, Ma Benedicta, Dr. Tata, Chairman Amos. Contact anybody you know. You land on us. Sorry, we didn't have that payment uh, link ready. Dr. Paddy is probably preparing for Undaunted very soon. And again, this was an very impromptu program. Sorry if it wasn't really up to scratch, but we're better off with a bit, than nothing. So I hope the take home messages are clear. Gout is due to an excessive increase in uric acid in our bodies, which is a breakdown product of purines. And for whatever reason, whether it's because your kidneys cannot excrete that byproduct, or whether you have some enzyme defect that blocks the final breakdown. Anyway, it leads to that increase in your system, and those that substance forms crystals and accumulates in your joints, causes inflammation, which is why you have that acute pain, swelling, and heat in the joint. Half of the time, it is the big toe that's affected, but it is not only the big toe that can be affected. Any other joint can be affected, from your ankle to your knee to your hand to your elbow, but it's usually one joint at a time. What is important is to seek medical advice as soon as possible, but avoid excessive eating, especially foods that are rich in purines. You can Google them. Meat, red meat particularly, is a very bad one. They say tomatoes as well. Um, you know, Alcohol. So cut down on your alcohol or completely stop it if you have gout, because anyone who has gone through the pain of gout, if you hear them scream, I'm sure they'll give up alcohol in a second, if that's going to stop uh, the second attack. So I hope that was helpful. Stay tuned. I don't have a regular program yet because I have a very fluctuating work schedule as well. So whenever I am on morning shift and I am able to squeeze time, like today, I'll be able to do something. But with time, I'll be able to announce this ahead of time so that I can prepare myself, and you can also be ready to watch. So thank you for watching, and stay tuned for our next programs on ABC TV. Undaunted is coming up soon, and do not forget, please order your wrapper to support your ABC Amber TV. And everyone actually should be having this wrapper come October 1, 2023. The president has actually announced and is making an appeal across the globe that we should revive, the come-togethers again. COVID came and brought that distance, and we were doing everything online. And we know the effect, we know the usefulness of meeting each other face to face. Nothing replaces that. So it is such a motivation to one another. So we want to celebrate this 7th anniversary of our Independence Day since the struggle started in 2016 in a very special way. We want it to be an all blue white occasion across the globe. So Germany is hosting for Europe, and we're expecting that everybody will be pulling into Germany come October 1. And please have your rappers, because we're going to have a contest of the best outfit, the best amber outfit of this special year. And this goes also, we also have t-shirts that are going around. Please make sure you have all of our national regalia so that we can flaunt them, so that we can parade them. It is our day. We see people with political parties, they wear their flags, they wear this, they wear that. We have to have a sense of belonging. And that is our flag, and that is our amber wrapper. And those are our amber t-shirts, our amber cups, you name it, key holders. So please be proud of your heritage. Be proud of who you are, and order your wrapper today. Do not delay, because we have limited supply. So once more, ladies and gentlemen, thank you for watching, and see you sometime soon. Hopefully not too long. And please see you at the KMC draft this Saturday at 8 p.m. Amber time. Thank you. God bless.
The piece of cloth made in Ambazonia, a land brimming with history, courage, and the indomitable spirit of its people, a profound reflection of Ambazonia's collective identity and our unyielding struggle for freedom.
A full representation of who we are, what we are, the history, story, and the struggle. It's a piece of cloth you should have in your closet. It is woven into a rich tapestry of cultural heritage, traditions, and long-standing desire for self-determination. Proudly adorned with unique patterns and symbolizes unity in the Ambazonian people.
The cloth's patterns and colors mirror the courage and hope that fueled their aspirations for a brighter future. Each thread represented a story of bravery, sacrifice, and the unwavering commitment to justice.
The piece of cloth made in Ambazonia became more than just a garment. It transformed into a symbol of a call for recognition, worn proudly by Ambazonians and their allies worldwide. It carried a message: we exist and we deserve to be heard. As long as the cloth adorns chests and shoulders, the spirit of Ambazonia lives on, and the hope for a free and united land remains alive.